In this video, I will discuss Modafinil versus Adrafinil. Modafinil and Adrafinil are currently the only two members of the eugoroics class. Eugoroics act as stimulants and promote wakefulness. They were developed to replace amphetamine use. Eugoroics are relatively non-addictive and non-dependence forming. Adrafinil is the earlier version of modafinil. Modafinil is the main metabolized element from adrafinil, and both drugs have similar activity. But adrafinil requires a larger dose for an equal effective strength. Adrafinil targets the same brain receptors and makes them more responsive to norepinephrine, but it is not as specific or potent as modafinil. Users who have tried both have noted some differences. Adrafinil has a motivational effect, and users are keen to undertake intellectual work. They will often stick with the task in hand for far longer than normal. This effect is less intense in modafinil, but still present. Adrafinil is reported to produce a form of inner tension that modafinil does not produce. Adrafinil produces a more down and dirty sort of stimulation. Conversely, modafinil stimulation has been subjectively evaluated as finer. It is easier to fall asleep after modafinil than after adrafinil. Modafinil does not seem to produce any post-dose exhaustion and works when taken consecutively for a number of days. Average doses of adrafinil are higher, 600 to 1200 mg per day for adrafinil versus 200 to 400 mg per day for modafinil. Adrafinil is attributed some side effects which have not been associated with modafinil: stomach pain, skin irritations, and inner tension. Continuous adrafinil use requires regular blood testing to monitor liver enzyme levels. The same is true of modafinil, but to a lesser extent. I will end with a subjective description of how it feels to use modafinil. This description is consistently accurate for most, but not all, modafinil users. After ingestion, you may feel that little has happened. But modafinil does not induce spikes of attention. Rather, it enables a stable plateau of attention. What you will find is that many hours later, you are still attentive and completely focused on the task at hand. This enables you to undertake intellectual work or study for extended periods of time. Remember, with modafinil or adrafinil, you will not feel differently. Therefore, there is no need to increase the dose. Before even considering increasing the dosage of modafinil or adrafinil, you should start with the lowest dose and monitor its effects over 5 days or more. Make sure you watch the video How to Use Modafinil. In summary, modafinil and adrafinil are similar in effects, but modafinil is considered slightly superior, due to having less side effects and requiring a lower dose. In closing, I advise against using modafinil or adrafinil. If you want cognitive enhancement or to fight off tiredness and chronic fatigue, then there are supplements which are safer and which you should try before modafinil or adrafinil. But I believe many will try it anyway, so you might as well be correctly informed. In this video, we have discussed modafinil versus adrafinil. If you want to discover things about modafinil which aren't included in this video series, then go to damianalexander.com/modafinilpdf. If you want to learn more about critical nutritional supplements, life extension, and disease prevention, then subscribe to my YouTube channel at Damian Alexander's Vids. Lastly, discover the easiest and shortest way to double physical and mental energy, strengthen immunity, and restore health by visiting howtochangeyourownbatteries.com.